U.S. is right now seeing its most intense flu season in 15 years, according to new data from the Centers of Disease Control and Prevention. The number of doctor's visits for those flu-like symptoms is its highest since the swine flu pandemic in 2009. Joining us today to discuss how to keep you and your family safe is public health educator Dr. Griggs. Good Sunday morning to you, Dr. Griggs.
Good morning.
All righty, flu season. I know a lot of my own friends and family are starting to wake up with the crud and it's getting worse. So what's making this year so much worse than other years?
Well, you know, it varies from year to year. You have a lot of people that are really not getting vaccinated. You have a lot of people that are just glad to be outside, and it is peak flu season. We're starting to fall into that. We've just come off multiple events. Louisiana we were #1 in the country for about 2 months with incidents of flu. So it's that time of year. We're outside. It's Mardi Gras season. We just finished the Super Bowl. We just had a snow where people were crowded in with each other, and a lot of people have stopped doing things to prevent getting infected with their hygiene. Less washing of hands, closed spaces, not covering our nose.
We're getting dirty.
Yeah, we're getting dirty. So we have to go back to it. We can start with the basics of washing our hands. If you don't feel well, stay home. If you must go outside, wear a mask. Of course, we want people to get vaccinated. Ventilated areas, getting enough sleep. None of this sounds like Mardi Gras, but it's all those things that we need to do so we can enjoy it.
We have to keep saying it because nobody's thinking it, of course, during Mardi Gras. You're thinking about everything else. So talk to me about these vaccines, right? I know people kind of go, you know, this or that on a flu vaccine, but explain to me, you know, how it's beneficial and why someone should get it.
So typically, you know, at the beginning of fall to the peak season, through the peak season of now, mid-February through the end of February, early March is flu season. You want to get your flu shot, and it takes about 10 to 14 days for it to kick in. Now, what the vaccine does, it does not prevent you from getting the flu. It prevents you from getting severely ill, hospitalized, or tragically possibly dying. We've had 13,000 people thus far die from the flu, and we're not finished yet. So it's important that you talk to your healthcare provider about vaccines, not just flu shot, but COVID. There's a new shot with RSV. I have a friend that's an infectious disease doctor, another friend that's a pediatrician, and they're pleading that people get vaccinated and do things to protect themselves.
Is it too late to get the flu shot now, or you could get it today?
Yeah, you can absolutely get it today. Carnival, you have time to protect yourself. But the big thing is you need to practice the things that you can control, whether you get your vaccinated or not. Washing your hands, getting enough sleep, hydrating, eating proper foods, staying at home if you're sick. How about that? Staying away from people if they're sick. Not being rude, but like taking a step back, so you don't get sick.
Yeah, it's going to be difficult to tear yourself away from the parade route if you are ill, but it happened to me last year. I went to a parade party and someone had the flu, and they knew they did and got us all sick, and it was not a fun Mardi Gras with the flu. So some of those symptoms, though, if you might start to feel the cruds, how you can tell it's different from the flu.
So
what will we feel? The
difference between, it's like the Mardi Gras cruds, which would include the colds or your other respiratory viruses, not COVID, would be the flu jumps on you like a bear. You audit the muscle aches, the chills, the fever, loss of appetite. A lot of times there can be GI symptoms like the nausea, vomiting, the diarrhea, but it's very, very sudden. Anyone that's had the flu, if you had the flu, you know, uh-oh, this is the flu. For myself, it starts with chills.
Yeah, it's the aches.
I've missed an entire Mardi Gras. Went to a parade and started feeling sick and missed the whole thing.
Yeah, it happened to me too. It could happen to you, so wash your hands.
Wash your hands, drink your water, get your flu shot, stay away from people if they're sick. If you see someone sick at a party and it's a closed environment, back away.
Back away. All right, thanks, Dr. Griggs. Great advice for us as we ramp up the carnival season. We love it.